Hi everyone, my name is Harish. I am part of the academia team at Intermed School, and as part of this month's lecture series or case presentation series, I'm going to be talking about stroke. Now, in a similar format to the other presentations that you've hopefully had a chance to see and engage with from previous months, I'm going to briefly talk about what stroke is, talk about some of the causes, some of the ways that patients present, the symptoms that they have, how one would investigate for it, how you would treat and manage patients, and then briefly at the end I'll talk about some of the key takeaways from this presentation. Now, although it's very unlikely that you'll have covered stroke previously as part of your academic studies at A level, hopefully you'll have encountered the brain before and you'll have some understanding or some sense of the fact that the brain has a very important, a critical role to play in doing things like coordinating movement, in enabling us to perceive the world around us, in facilitating sensation. And you might not know the exact process by which this happens, and I'm sure once you commence your medical studies you'll be able to explore that in more detail, but hopefully you have some understanding that the brain has these roles to play. And hopefully you also understand and know that blood supply and oxygen is absolutely critical in ensuring that cells and organs all around the body are able to perform their functions. It's important that cells can respire, and in order for that to happen, blood supply to the area needs to be there to deliver oxygen. And the brain is no different in this respect. Blood supply to the brain is absolutely of the highest importance. So what exactly then is a stroke? So a stroke is a medical emergency that is caused by restricted blood supply to the brain. So we just spoke about in the last slide why the blood supply is important. Stroke results from restricted blood supply to the brain. And that then causes a number of different deficits in terms of nerve function. So people will lose their sensation. They might not be able to feel touch. There'll be a loss of coordination. They might not be able to move their limbs, their arms, their legs. They might lose their speech. They might find it very difficult to talk. All of this is because the nerve functions have been disrupted because the blood supply to the brain has been disrupted. Now, there are two main kinds of stroke. One, the main type, the majority of strokes are ischemic strokes. This is 85% of strokes. And that's what we're going to focus on today. But it's important that you know that there is another kind of stroke as well, and that's hemorrhagic stroke. And hemorrhagic strokes are caused by bleeding, effectively. So there is bleeding, there's like a ruptured blood vessel, and that then, of course, disrupts the ability of the blood to flow to different parts of the brain. An ischemic stroke, and as I said, that's what we're going to talk about today, is not caused by bleeding, but it's caused by a clot or some kind of blockage in the arteries. So ischemic stroke, blockage, so blood supply can't reach different parts of the brain. Hemorrhagic stroke, bleeding. But we're going to focus on ischemic stroke. So what are some of the key risk factors for ischemic stroke? And there are a number of different ones. Some of these are irreversible, unchangeable, things like your age. So the older you are, the greater the risk. Things like being of male biological sex, that increases the risk as well. And then there's things that are modifiable, what we call modifiable risk factors. So smoking and having a poor fatty diet increases the chance of clot formation, and that can then increase the chances of having ischemic stroke. So what are the key symptoms of stroke? Now, there are many different kinds of symptoms that someone with a stroke might have, depending on which area of the brain has been affected. Depending on which artery has been affected, different parts of the brain might not get the blood supply, and depending on what kind of responsibilities or functions that part of the brain has, those are the kinds of symptoms that the patient may have. But some of the key symptoms that you might see someone with stroke having, there are motor and sensory symptoms, very commonly. So for example, they might feel numbness in a part of the body that the brain is responsible for supplying motor innervation to. So nerves might go down to different parts of the body. If that's been disrupted, they might not be able to feel anything. They might feel numbness there, or they might feel weakness. They might not be able to walk if it's in the leg area. They might have difficulty walking. So there's these motor functions in terms of movement and sensory functions in terms of feeling that will be disrupted. But it's not just motor and sensory symptoms that someone with stroke will have. They might also have other symptoms. They might have a headache, Their visual fields might be disturbed. They might have a loss of vision. They might find it difficult to talk. Speech might be affected because the brain is also obviously responsible for language and for our speech. So they might suffer from something called aphasia, which is related to difficulty with language. Okay, so we've talked about what a stroke is and what kind of symptoms patients may have. How would you investigate? What kind of investigations would you order to confirm or diagnose a stroke? So one of the most important forms of investigation, forms of imaging, is what's called a non-contrast CT scan of the brain. And what this will do is help to distinguish between an ischemic stroke and a hemorrhagic stroke. And that's very important because you do not want to treat an ischemic stroke like a hemorrhagic stroke, and vice versa, you don't want to treat a hemorrhagic one like an ischemic one. It will worsen the patient's presentation. So it's very important that you understand what kind of stroke it is, and a non-contrast CT scan will help to visualize the brain and help the clinical practitioner determine whether or not the patient is having an ischemic stroke or a hemorrhagic stroke. There's another kind of imaging called CT angiography, which involves picturing the blood vessels in the brain. And so that can help to identify which blood vessels are blocked and if they are blocked. I've mentioned here there's an echocardiogram you can do. So that involves visualizing the heart. And the reason you do that is because there's a condition called atrial fibrillation, which predisposes patients to have clot formation. And these clots can then become dislodged and they can move to different parts of the body. So it might be near the heart, it becomes dislodged, it can travel up the bloodstream, and suddenly a clot might form in arteries that supply the brain. So you might actually even do imaging of other parts of the body to see if there's any kind of clot formation there. And then, of course, you might do general forms of investigations like serum lipid levels, just to assess the risk factors to see if they have any of the risk factors we spoke about previously. Okay, so you've investigated it, you've diagnosed the patient with a stroke, more specifically an ischemic stroke. How do you treat these patients? Now, if it's within 4.5 hours of the start of these symptoms, so suppose they've got all this muscle weakness and they've got the loss of feeling, loss of innervation, loss of sensation, and all of this has happened within 4.5 hours, you can do something called thrombolysis. And what thrombolysis is effectively breaking up the clots. So a thrombus is a clot, lysis is to break up, so you're breaking up the clot. And by breaking up the clot, you're improving the blood supply to the areas of the brain that previously the clot was preventing the blood from reaching. So you might use medication. Very well-known medication is called alteplase, and what that does, as I said, is it breaks up the clot. So that's how you might manage these patients more acutely when they're very unwell with these symptoms of a stroke. But it's also important to consider the longer-term management. And with respect to the longer term management, there are medications you can use like statins. And what that does is it reduces cholesterol levels, it reduces the lipid levels, and that reduces the risk factor for future strokes. You can use antiplatelet drugs. Very well known one is clopidogrel. Again, that reduces the chance, the likelihood of a clot forming. So there's these medications you can use in the longer term to reduce the risk of it happening. And of course, like with many conditions, it's important to advise patients on maintaining a healthy diet, and if they're smoking, to point them in the direction of smoking cessation services, because as we mentioned, those are also risk factors for a stroke. So a couple of key takeaways from this case. The first is the relevance of anatomy, and anatomy will be a very important part of your preclinical studies in medicine, particularly in the early years of your medical degree. There'll be a lot of focus given to anatomy, and that's because the anatomy plays an important role in identifying and understanding why patients are having the symptoms that they are. If you understand the anatomy of the brain and what arteries are supplying different parts of the brain, you'll be able to better understand why patients are having the symptoms they are, because you'll know it's this part of the brain that's affected, this part of the brain is responsible for XYZ, and that's why XYZ is affected. So one key takeaway is about anatomy. Another key takeaway is about the distinction between acute symptoms and chronic symptoms. So we spoke about acutely, someone's come in within 4.5 hours, they're having a stroke, they're having all these symptoms, and you might treat that, but it's also important to consider longer term risks and preventing it from happening in the future. So more chronic, more long term. And it's important to understand that treatment should address both aspects of it. So that is this month's presentation on stroke. Hope you've found it interesting and you've gained something from it. And yes, hope you are able to continue reading about it, investigate it in your own time. As I said, don't worry about it too much because you will absolutely encounter stroke in your medical studies. And I look forward to presenting another case for you guys next month. Thank you.